for this opportunity. And I just want to say hello from Mexico, in Guadalajara, particularly on the west side of the country. And it's my pleasure to share with you some data that we have been building through the years since 2016. So Mexico, it's a big country, 132 million, which is a great opportunity to work in the health sector. In the city where I live, it's Guadalajara. We are about 5 million, but the state of Jalisco has 8 million people. So now you can see in my screen the distribution of the population, which is very important comparing with some countries in Europe or probably in Asia. That gives us the opportunity to work in the health sector in different areas, because now we have a very young population, as you can see, but in a short time we'll have very elderly population. So there's an opportunity to work for these people and not forgetting what we have as a very responsibility going on these days. So why? Because our mission is to facilitate the knowledge, influence in the policies in the government locally and nationally, connect, networking, and it's very important for us to innovate. All our activities are focused on the innovation, on the benefit of the people, and disseminating the innovation. It's something important, and a cross-sectoral cooperation, which I will be mentioning through my presentation. And I don't want to leave behind the holistic decisions that have to be taken in this sector. This is the route that we have been following from Jalisco, the national. In America, we have some connections. With not all of them, we would like to open it more, and with these countries in Europe as well. So we have been invited by some embassies to present our ecosystem, mainly in Norway, Netherlands, and Spain. I'm the prescriptor of the Madrid Investment Attraction in Mexico, which is a great opportunity for all of us to work together. And as the clusters or the ecosystem have to be in touch with different stakeholders, and these are the ones that we're working with mainly. We have good and very big universities here and research centers in Mexico, and particularly in Jalisco. So we'll be so pleased to join with other countries, which is great. Big companies and nonprofit organizations as well, startups that I've just took note about the opportunity to bring them to some other places to pitch their projects. SMEs, because Mexico has 90% of SMEs and 5% of big companies, which is a great opportunity used to make them grow and to help them to do something much better in benefit of the population. These are some of our partners. You can see in the right side some universities, research centers, big hospital, a public hospital. It's Hospitales Civiles, 108,000 beds. And we have now a new community from Spain. It's a startup that's working now with artificial intelligence for kids. And we have groups of professionals like doctors and medical devices, engineers, and also in the pharmaceutical sector. So, and as well as the government, we work very close with our government here in Jalisco and with some embassies, as I show you. I want to point something important, that the public sector attends 80% of the population and just 50% are attended by the private, which is the different way to approach the patients, but the opportunity as well are here. I want to point out some of the most pathologies that we have to live with, and here is the opportunities to work together with the rest of the world. Here I will not read them because you can see them: non-communicable diseases, infectious diseases, mental health problem. We're having a lot nowadays: depression, anxiety, and alcoholism, and not just in the elderly people, but in young people, and assisted fertility as well. Okay. And what's something that I want to point out our population, it's very diverse. And for the genetics researchers, it is great that what we do have a lot of variety, which gives us the opportunity. So I just want to say that what we are working mainly now and look at collaborations for precision medicine, artificial intelligence and diagnostic, and mainly in prevention, because we have a lot, number one in the world with obesity in elderly people and in adults and in children. And digital health, we want to build it more strongly. So we want to be very proactive in the management, early detection, and damage containment, because we have a lot of population now. So we have to work in prevention, but contain this damage. We have a lot of kidney damage as well as a result of diabetes. So this is a great opportunity to join efforts. And I just want to, before closing my presentation, I would like to raise my hand talking about rare diseases, or now that they're, sometimes they are very invisible. So the number, in the world is very high, but the diagnosis is very late, sometimes 4 or 10 years. And the treatment sometimes is very rare. So it's quite not so easy to get the drugs and to make the diagnosis. So now we know we're working with Takeda very close. One of 17 persons in the world have rare diseases. Mm-hmm. And this is just my call now. If some of your people in your ecosystems are working, we would like to be in touch. And this is a message of the State Commission of the Human Rights in Jalisco we work. Because as I told you at the beginning, we work in an holistic way. And these are the, some sentences that they have shared with me, and I want to share it to raise awareness about who provides the health services, dialogue and demand in between the authorities and all the professionals that work in this, and social awareness about the inclusion and non-discrimination of the people. So this is my call today. If you have something to do with this and you know anybody in your ecosystem, please let us know, because we're very anxious and we're very open to work together. So the cooperation opportunities in technology, entrepreneurship, ecosystem, pharmaceutical and biotechnology, in clinical researchers, in the life science, medical devices, and invest in the scientific collaboration. So thank you so much. I'm very welcome to Guadalajara, which is a beautiful city, always in the springtime, and a lot of things to do. I'm very well connected and a lot of activities to do here. So it's my pleasure, and thank you so much.
Gracias, Georgina. Thank you very much. And our connection with Georgina goes back many, many years. And I'm so pleased today to be able to present, I think, a number of different opportunities there for people to collaborate.